swine influenza virus and confirmation through real-time PCR. So, Dr. Imran, are you there? Can you hear me, Dr. Imran? We have some connectivity issue with Dr. Imran Mirza. So we move to the next speaker. Dr. Punzar is not here. So the next speaker is Dr. Tanveer Hussain. The title of his talk is Public Awareness and Management of COVID-19 by Medicinal Herbs Grown in Bilwar, Azad, Jammu and Kashmir. So it is over to Dr. Tanveer. Dr. Tanveer Hussain from Azad, Jammu and Kashmir. Can you hear me, Dr. Tanveer? Okay. If Dr. Tanveer is not there, we move to the next speaker. This is Dr. Adila Rahman. Are you there, Dr. Adila Rahman? Dr. Adila Rahman? Yes. She's there. Okay. The topic of her presentation is practices of complementary and alternative medicines in COVID-19 pandemic. So it is over to Dr. Adila Rahman. She is the last speaker of this technical session 1. Dr. Adila, you may mute your mic, share your presentation, and then turn your mic on. You may now go to the slideshow, please.
Hello, can you hear me?
Yes, we can hear you. Please go ahead. Now you can share your
Thank you so much. So because of that, yes, I'm going to share because of the administration was not allowing me to open my mic. So that's the problem. Thank you so much for giving me this opportunity. I'm just going to share my own experiences, my family experiences, my community experiences with respect to COVID-19. COVID-19 experiences for using practices of complementary and alternative medicines in COVID-19 pandemic. As we all know that from November 2019, as a nation across the world is suffering from COVID-19 and looking for the best possible solutions, treatment to prevent and cure from the disease. Although in the contemporary world, because of that, we are very used to the contemporary medical sciences, which is known as the allopathic medicines. So in that contemporary practices, it is very hard to believe on the alternate medicine, particularly herbal medicines. But after that COVID-19 received and many empirical evidences also supported that in many countries they started working on using complementary medicines, including traditional herbal treatment alone or in combination with the standard management procedures as an option for prevention of treatment of COVID-19. Countries have either started or are preparing to conduct trial studies of traditional medicines to assess the efficacy of such therapies in coronavirus disease. So my paper is just reflecting or highlighting the importance of indigenous resources, practices of complementary medicines for the prevention and curing of COVID-19. What is the complementary and alternative medicine? It is the unconventional therapies which is referred to as complementary therapies or alternative medicines frequently becomes a primary treatment modality that replaces allopathic medicine, and that is gradually and slowly and gradually replacing allopathic medicines. We are not criticizing the allopathic way of treatment over here. We are just mentioning that besides allopathic medicine, there are other complementary and alternative medicines modes which we are grappling and which we are using. And after COVID-19, their significant effects can be seen. There are 5 major domains of complementary and alternative medicines, which is divided into 5 categories. Alternative medical systems include homeopathic, Chinese, Native American, Aboriginals, African, Middle Easterns, we can say in Asia is a tip or other kind of the herbal medication system which is available or which is a proper system working in those countries or different countries. Second is mind body intervention, which is focusing on the psychological parameters including therapies, mental healing. Third is the biological based therapies such as dietary supplements, herbs, and various kind of combination of the treatments, or you can say the vitamins or tablets we take. Manipulative and body-based methods, these are the manipulation of the massage or aromatherapy or the other osteopathic treatments which we use in this category. There are fifth category which is known as energy therapies, Reiki, therapeutic, bioelectromedical, or you can say that the treatment by using different electromedical medical or magnetic waves to cure certain diseases. Various literature also shows that, and latest literature in 2020 also evidenced that various recent studies used in a different part of the world, people of the population or the community use herbal medicines or other alternative medicine for the COVID-19 globally. And these are very recent studies conducted in 2020, and I'm sure in 2021 various other researchers have also been studied to evident these facts that herbal medicines also plays an important role besides the allopathic treatment, and it is effectively using after the COVID-19 pandemic. My research study is focusing on the knowing the importance of indigenous resources of practicing complementary medicines and what are the experiences of families while using this complementary medicines. So this is a very small study, qualitative study in which in-depth interviews were conducted from 6 COVID-infected patients, including 3 male and 3 females in the nearby surroundings of Complementary in Islamabad. It was by using snowball techniques and taking the informed consent from those COVID-19 affected patients when they were cured from that COVID-19. The interviews were taken. After taking the interviews, descriptive thematic analysis was performed. Quickly sharing, because we have time, results and discussion. Majority of the respondents mentioned that although they were taking some contemporary medicines for killing the germs, but simultaneously they improved their diet, eating habits, and have taken liquid and herbal tea. As one of the respondents quoted that during the time of COVID-19 pandemic, our family used to grind mountain herbal tea, which is known as Tamila, which is available in Gilgit, and the people in northern areas use it on a daily basis. Because they mentioned it is a good for preventing fever and flu, not only in the pandemic, but we also use it in our daily life as a green tea. One of another respondent added, although there is no evidence that eating garlic has protected people from COVID-19, however, garlic is a food that may have some antimicrobial properties. We used to take boiled water to Shanda, kahwa, milk and egg for reducing weakness, inhaler for nasal congestions, tablets like Boston and Panadol, and following other SOPs such as wearing masks, use of sanitizer, washing hands, and keeping social distancing from family and avoid public gathering. So it shows that while having taken care of taking some medicines which we consider a contemporary medicines, they were using many kinds of herbal treatment and taking care of all other SOPs that was required during and after during the pandemic. Some other respondents also mentioned that besides herbal treatment, some of the respondents highlighted that taking fresh fruits and vegetables are also very effective during COVID-19. Some of the respondents also shared that experiences for taking herbal medicines. If someone felt sore throat symptoms, then we used to make ginger and cinnamon tea. Otherwise, cinnamon dissolved overnight in the cold water and drank first thing in the morning. So these were the experiences which they shared with us. Similarly, another respondent added that self-care is primarily should be the first priority in the case of being affected with COVID-19, so they were taking green tea, soup and tea at home. The sources of information they have obtained to use these kind of herbal medicines were the indigenous knowledge and practices of their parents and grandparents. Then obviously that is the time of digital media, social media on their Facebook, WhatsApp, Twitter and YouTube videos which were continuously producing such kind of stuff, and people were following and trying. When they try and if it is effective, then it makes their habit to use it. Neighbors, relatives, friends and teachers. Whereas news bulletin, newspapers and radio was also utilized at a minimum level to gather the authentic information. The finding reflected that people were aware about their preparedness of COVID-19 and adopted timely measures. So the study concluded that complementary medicine school is very important not only in the pandemic, but its benefits for keeping a normal body healthy. Most of the families and individuals were using this complementary and alternative medicine based on their own indigenous knowledge and practices of their ancestors. Besides social media sites and consultation with doctors, friends and herbalists was also taken to use folk medicines, which also indicated that CAM is socially accepted by the families and communities. A way forward is that the study recommended based on its effectiveness, affordability and ease of use, complementary medicines should be integrated with the contemporary health system of Pakistan as well as in the discipline of public health. So being a medical sociologist and public health researcher, this is my greatest stance that in the contemporary healthcare system, our public health discipline, particularly this forum, must communicate some policy level decision to the government that just like China has incorporated this CAM into their medical system and they are now developing and they have a good health system over there. So this is my recommendation as well to the public or at the policy level to at least give some importance to that CAM in order to incorporate as in the formal healthcare system. Innovative methods of science and technology can also be used because we are living in the digital world. Globalization is also impacting, so we can use science and technology in a very effective way to utilize or to promote these complementary medicines. With this, thank you so much.
Thank you, Dr. Veena, for sharing your knowledge on complementary and alternative medicine in COVID-19. Thank you very much. Ladies and gentlemen, Dr. Veena was the last speaker of this session. And in this session, we have 9 presentations. 3 were international. One from Russia, Professor Mikhail. We discussed digital hygiene against pandemics. Professor